Hello, my name is Thomas Reiberger. I'm a hepatologist at the Medical University in Vienna and currently also the working group leader for liver of the Austrian Society of Gastroenterology and Hepatology. Today I would like to give you the Austrian perspective on fatty liver disease in the context of the International NASH Day. We know that in Austria we have similar risk factors for the global epidemic of fatty liver disease, which is on the one hand dietary habits, but also on the other hand a pathological consumption of alcohol. You can see the famous Wiener Sachertorte, which is an example why Austrian people love sugar in the diet, but also the famous Wiener Schnitzel that is usually consumed with at least one beer. So these risk factors are typical risk factors for fatty liver disease, and that's why also in Austria we face an increasing incidence of fatty liver disease. We know that fatty liver disease is not a harmless disease. It can cause liver failure and also liver cirrhosis and liver cancer. And alarmingly, these numbers go up also in Austria, so we need to have an increasing number of liver transplantation and diagnose also an increasing number of patients with liver cancer on the basis of fatty liver disease. If you ask your question if you might have fatty liver disease, you should on the one hand check if you have an increased amount of belly fat or if you have diabetes. These are two typical risk factors for fatty liver disease, which should call you to the doctor for a checkup. Importantly, fatty liver is characterized by an increased amount of fat in the liver, which eventually will lead to inflammation and scarring, which is fibrosis or cirrhosis, and may lead to severe consequences such as liver transplantation or liver cancer. The symptoms are rare and unspecific, meaning that there is usually no typical symptom that might lead you to diagnosis. That's why it's important to do the basic exams if you think you might have fatty liver. And these include, importantly, the liver enzymes, most importantly ALT and GGT, but also blood fats like triglycerides and long-term sugar HbA1c. And your doctor should also refer you to an ultrasound examination, which are the first and basic exams to know if you may suffer from fatty liver disease. Ultimately, and that is very important, you need a confirmatory test. And this is usually done by elastography, in this case FibroScan, which can really diagnose how much fat there is in the liver and if there is already scarring, that means fibrosis. If you are diagnosed, you need to get a specific treatment, and importantly, the most important treatment is the modification of your lifestyle, which includes dietary factors and exercise. A good news might be that you should drink a lot of coffee, which helps your liver to recover. All of these should be supported by a specialist, and these specialists should, in perfect scenarios, include a hepatologist. In Austria, similar to the global epidemiology, we face an increasing number of patients with fatty liver disease. Importantly, many of those patients have only steatosis, that means an accumulation of fat in the liver, but still there's a subfraction that have progressive disease and they can develop fibrosis, cirrhosis and even liver cancer. We know from new data that about 1/3 of the Austrian population might have fatty liver disease. If you look at the population with diabetes, these numbers might even go up to 60 or 70%. The proportion of patients with advanced disease, fibrosis and cirrhosis of the liver is fortunately lower. We expect about 5% of the Austrian population to have a liver fibrosis, that means also a scarring of the liver due to fatty liver disease. And these numbers underline the importance of awareness about this disease in the general population, but also call for action among the physician and the politicians and the societies to look for strategies to target this epidemic disease also in Austria. Finally, I call you for a checkup for your fatty liver disease at your doctor and send you best greetings from Austria.